In this lesson, you will learn specifically how to identify the normal fetal anatomy of the head, heart, abdomen, spine, and extremities in the second and third trimesters when these structures are readily visible. We will also show how to recognize the skull, face, and structures of the brain, including the ventricles, cavum septum pellucidum, that we sometimes abbreviate as CSP, thalami, cerebellum, and base of the skull. This is a sagittal profile of the fetus. Please ask your trainer to show a sagittal position with a doll. Because the skull is bone, it is hyperechoic, so it will appear white. Here we can see the face and the skull. This picture shows the skull in transverse. The skull is oval on cross-section, and in the next lecture, we will show you how to measure the skull to determine the gestational age of the fetus. The dashed line here shows the measurement of the biparietal diameter, or BPD, which allows estimation of the gestational age. This fetus is 15 weeks and 5 days in gestational age. This is the transverse view of the head in an older fetus. In this case, the BPD measurement estimated a gestational age of 26 weeks. This is what the face looks like in profile very early in the second trimester. Which features of the head and body can you clearly identify? Please pause the video now to encourage responses from the group. Here we have labeled the skull, forehead, nose, body, spine, and a leg to make them more obvious. Here is what the face looks like in an older fetus in profile, which is called a sagittal image. Can you see detail in the fetal face? Here we have labeled the forehead, nose, and lips. Now we are going to look at the brain, starting with a basic diagram. The darker gray structures in the center of the brain are normal fluid-filled structures called ventricles. The 3 lines are different levels of scans or slices through the brain. We need to know how the brain looks at each slice level because we must image a specific level to estimate gestational age, which we will learn later. We will talk about these levels more in the next slides. This is a transverse image of the fetal head at level A, which is best to see the ventricles in the brain. We can see how level A slices through the ventricles, just above the middle. The ventricles are filled with fluid, so they are anechoic or black. The echogenic material in the ventricles makes the fluid, which is called the choroid plexus. This is a transverse image of the fetal head at level B. This level is very important because we will make a measurement at this level to estimate the gestational age of the pregnancy. We will cover this in the next lecture. Level B slices through 2 structures called the thalamus and the cavum septum pellucidum, or CSP. The thalamus has a heart shape and may be easier to see if we outline it like this. The CSP appears as a small black box and is located just in front of the thalamus. Near the bottom of the CSP, it appears as 3 white lines instead of a black box. It may be easier to see if we outline it like this. The CSP may not be seen before 18 weeks gestation. This is the same transverse image of the fetal head at level B. There's another very important structure to identify, the strong white line in the middle called the falx. You can also see the falx at other levels. This structure is important to recognize because it will help to show where to make the proper measurement for determining gestational age. Let's review again the appearance of the thalamus, CSP, and the falx. The thalamus often has a heart shape, and the CSP is located just in front of the thalamus. The CSP appears as a small black box or as 3 white lines. Next, please identify the falx in both images, which is the strong white line in the middle of the skull. Please pause the video now to ask participants to help identify the falx. Here, we have labeled the falx to make it more obvious. This is a transverse image of the fetal head at level C. You will see a structure in the lower posterior part of the brain called the cerebellum. The cerebellum is important for maintaining balance and posture. It is shaped like a very fat number 8. Here we have outlined the cerebellum to make it more obvious. Then we will remove the outline to allow you to find the cerebellum in the image again. The orange line on the diagram is a transverse cut through the base of the skull. The white hyperechoic structures at the arrow are bones at the back of the skull base. Please pause the video now so that you can take a moment to ask your trainer any questions that you may have about the head or the brain. Now let's consider the heart. In the second and third trimester, you can clearly see the heart beating. There are 4 spaces or chambers in the heart, the right and left atrium, and the right and left ventricle. Blood flows through the chambers and out the aorta to the rest of the body. Here is a transverse or cross-section through the chest. You can see the 4 chambers of the heart. We have placed a star inside each of these chambers to mark the location. The heart chambers contain blood, so they are anechoic. The walls of the chambers are echogenic. Here is another 4-chamber view of the heart. Can you see the 4 chambers? Once again, the stars are placed inside each of the chambers to make them more obvious. Here is a video of a beating heart in a fetus. You can see the motion of the cardiac valves in guiding blood flow from one chamber to the next.